Thank you, Senator Blumenthal. I just want to echo what Senator Wyden said about this attack upon the Congress, upon the Capitol Hill officers, and upon the staff. It's an actual attack upon democracy, and we all stand united, Democrat, Republican. There is no division amongst us. We have to keep this Capitol open and free for access, while at the same time providing adequate security so that incidents like this don't happen. But when one does, we stand united to ensure that we provide the comfort for those who have been harmed, but also the guarantee to those in the future that we will provide the additional security which is necessary. Everyone here knows what an epidemic looks like. In America last year, 33,000 people died from opioid overdoses. In Massachusetts, 2,000 people died from opioid overdoses. If people were dying across America at the same rate that they're dying in Massachusetts, 100,000 people would have died last year, but only 33,000 died across the country. That's a preview, however, of coming attractions, what's happening in Massachusetts. 1,700 people died from fentanyl in their blood system. If they were dying at the same rate across the whole country, that would be 70,000 people dying from fentanyl. This is an epidemic of unbelievable proportions. It's historic in nature. We tried to put together a bipartisan coalition last year. We did so successfully. The CARA bill was something which was successful. The 21st Century Cures bill, that was successful. But all of this bipartisan progress combating the opioid epidemic will be thrown out the window if Senate Republicans move forward with their plans to repeal and replace the Affordable Care Act. We know that the Senate Republicans are not going to completely rewrite the House-passed legislation, which will rip coverage away from 23 million Americans and gut Medicaid by more than $800 billion. The bill that they come up with will only make modest tweaks to that terrible legislation. In fact, any Republican health care proposal will be a wolf in sheep's clothing that only makes the opioid crisis worse in our country. By ending Medicaid as we know it and gutting consumer protections in the private insurance market, Trumpcare will shift billions of dollars in costs from substance abuse service and put that burden on the states and on families who cannot afford it. Experts say Trumpcare could cut upwards of $7 billion per year from behavioral health care by 2020, blocking people from accessing treatment and transitioning to recovery. This would be a death sentence to the 2.8 million Americans with a substance use disorder, including over 220,000 with an opioid use disorder who are at risk of losing their insurance if the Affordable Care Act is repealed. For individuals suffering from substance use disorders, repealing the Affordable Care Act isn't about repealing a health care law. It's about repealing hope. Hope that treatment is near and recovery is possible, and all to give billions in tax breaks to the wealthiest in our country. That is cruel, that is inhumane, that is immoral, to take the funding for programs for those who are sick and need help and then take that money and give it to the richest in our society is just plain wrong. Among the hardest hit by repeal would be those patients that access treatment and recovery services through Medicaid, which pays for nearly half of medication-assisted treatment provided in Massachusetts. In fact, Medicaid is the largest payer of substance use disorders in the country, and many of the states most devastated by the surge in overdoses, like Massachusetts, have relied upon Medicaid to connect residents to care. It would be shameful to take the coverage for medication-assisted treatment, which is half of all people in our state who get that coverage, take that money and hand it over to the other half of the people in our state as in the form of a tax break who can afford to get treatment with medication-assisted treatment. That would be wrong. That would be immoral. That's what their plan is. And no matter what the Republicans try, there's no treatment to make Trumpcare better. And if this bill becomes law, there is no Narcan for Medicaid. Once it's cut by Trumpcare, it is dead. We're hearing that Senate Republicans could create an opioid fund as a meager attempt to appease those who have called out the cruelties in this bill. That extra funding would be crumbs. It would be trading land for a couple of beads. That is what their proposal is going to be in reality. It will just be a sop to the discontented from their perspective. Republican health care legislation will rob access to coverage, treatment, and prevention for generations to come. But this betrayal of progress on the opioid crisis doesn't just end with the repeal of the Affordable Care Act. You have to see this in the total context of what they're doing. President Trump has proposed slashing the National Institutes of Health research budget by 18%, which will slash the ability to do the research to better understand addiction treatments that do not use opioids. The president is proposing to cut the State Department's International Narcotics Cooperation budget by 32%. That's the funding that helps stop the flow of deadly illicit fentanyl before it ever comes from Mexico or China into our country. And he wants to cut the CDC budget by 17%, undermining our ability to monitor the crisis so that states can deploy solutions. We are hemorrhaging lives every day, and Trumpcare will do nothing to staunch the flow of suffering and death from this opioid crisis. We cannot be fooled by this historically damaging legislation. This is the battle of the generation. I've been in Congress for 41 years. The most important vote that I've ever cast is for the Affordable Care Act. The second most important vote that I will ever cast is to block the repeal of the Affordable Care Act that the Trump administration is attempting to accomplish in this Congress. With that,